say that this topic is one of increasing concern to a lot of people. A colleague just told me that the FBI director, James Comey, was referring to ransomware in healthcare and the problems of cybersecurity in healthcare in a talk earlier today, which I'm trying to track down. Some people might be a little bit surprised at what I see as the top three challenges, but this is my perspective. Going back many years, but also based on things that have been happening recently. So I was working in healthcare security as HIPAA was coming into play, even before it was finalized, back in the late 90s, early 80s, as the English say. And it's been evolving as a problem, and it's become an increasingly difficult problem, I think. So we're going to talk about the multiple, what I call the multiple dimensions, about why is cybersecurity in healthcare so hard. And I think that if you're doing cybersecurity in healthcare, you probably know it's hard, but I actually think it might help to get some perspective on why it's so hard, particularly if you've been in cybersecurity in healthcare all along. If you've come to cybersecurity in healthcare from outside, you might have a perspective on why it's more difficult, or seems to be more difficult than in some other areas. Then we're going to talk about the skills gap, the cybersecurity skills gap, and how that is impacting things, and how you can respond as a healthcare organization to that. In my conversations with healthcare CISOs, I've come up with some tips from them and some insights into how to help with that. And then law and disorder. I just want to talk briefly about one of the problems I see for the healthcare industry, and again, some suggestions on what the healthcare industry might do about this. And then kind of wrap it up with a case in point. I just came back from HIMSS recently, the big health information management conference, and certainly in the security sphere, ransomware was the number one concern there. So how do these challenges relate to the problem of ransomware? And again, what can you be doing about that?